Welcome to UMCC, where your health matters to us. Ever wondered what causes those sudden emergency situations in healthcare? We're about to explore that. But first, let's define what we mean by emergency conditions. These are serious, often sudden health issues that require immediate medical attention. Think heart attacks, strokes, severe burns, or traumatic injuries. They're the things that make your heart race and your palms sweat when you hear the sirens blaring. Understanding emergency conditions is crucial. They can occur anytime, anywhere, and to anyone, from a child playing in the park to an elder sitting at home. Knowing about them helps us respond effectively, potentially saving lives or limiting harm. Moreover, for healthcare professionals, a deep knowledge of these conditions is invaluable. It can guide quick decision-making, helping to provide the best possible care when every second counts. Now that we know what emergency conditions are, let's delve into what causes them. Emergency conditions do not just appear out of thin air. They have causes. Often, these are the result of traumatic injuries, such as car accidents, falls, or sports injuries. But they could also stem from the sudden onset of severe illness, like a stroke, heart attack, or anaphylactic shock. And sometimes, they are the culmination of ongoing health issues that have reached a critical point, like uncontrolled diabetes or advanced cancer. But remember, the causes of emergency conditions can vary greatly from person to person. For example, a young, healthy individual may be more likely to encounter an emergency condition from a traumatic injury, while an older person with underlying health issues may face a sudden health crisis due to their chronic illness. And let's not forget, environmental factors, such as extreme temperatures or exposure to harmful substances, can also trigger emergency conditions. Understanding these causes is just the first step. Now let's move on to the effects of these emergency conditions. The effects of emergency conditions can be immediate and devastating. Physical harm is often the most conspicuous effect. It can range from minor injuries to life-threatening conditions, depending on the severity of the emergency at hand. Beyond the physical, however, the psychological trauma can be equally destructive. Emergencies can trigger intense fear, anxiety, or even post-traumatic stress disorder, changing a person's life in profound ways. Moreover, these situations may have long-term health implications. Exposure to harmful substances or enduring high levels of stress can lead to chronic illnesses, making emergency conditions a matter that stretches far beyond the immediate crisis. Yet, hope is not lost. Rapid and effective response can mitigate these effects. Timely medical intervention, mental health support, and preventative measures can significantly reduce the damage caused by emergencies. So we've covered the causes and effects of emergency conditions, but what are the key points to remember? Emergency conditions can be complex, but there are a few key points that we should always keep in mind. First, understanding the causes and signs of emergency conditions is crucial. Whether it's a sudden chest pain indicating a possible heart attack or an allergic reaction causing difficulty in breathing, being able to identify these signs can make all the difference. Second, it's important to know the potential effects of these conditions. They can range from mild discomfort to life-threatening situations, and understanding this helps us take them seriously. Thirdly, the need for a prompt and effective response cannot be overstated. Time is often of the essence in emergency situations, and quick action can drastically improve outcomes. Whether it's administering first aid, calling for medical assistance, or getting the person to the nearest healthcare facility, every second counts. Remember, knowledge and preparation are your best allies in dealing with emergency conditions. So, we've explored the causes and effects of emergency conditions, but what's next? Well, the journey to understanding and managing emergency conditions doesn't end here. It's an ongoing process. The medical field is constantly evolving, with new research and developments emerging frequently, and it's crucial to keep up with these advancements. Remember, knowledge is power. By staying informed, you're not just enhancing your own understanding, but also empowering yourself to make informed decisions in times of crisis. It's about being prepared, so that when an emergency strikes, you're not caught off guard. But it's not just about personal preparedness, it's about community resilience. Sharing this knowledge with others can make a real difference. It can help save lives. So, continue to learn, continue to stay informed, and most importantly, continue to share what you've learned. With knowledge, we can all play a part in managing and preventing emergency conditions. Stay informed, stay prepared. UMCC, your ultimate medical consultants connectors.